our next patient who joins us from Louisville, Kentucky, and represents our spinal business. David Johnson used to live a life in near constant back pain, and it was a struggle for him just to get through the day, as I heard last night at dinner. While he was an excellent candidate for spinal fusion, David's very busy life made the recovery period associated with the surgery, the traditional surgery, almost out of the question. Luckily, just 2 weeks after receiving his minimal access spine procedure with our new infused bone growth factor, David was back to work full time. David today is accompanied by his surgeon, Dr. David Rubin of Louisville Jewish Hospital, and I'd like Dr. Rubin to come up and introduce David.
I performed my first spinal fusion in 1978, and that involved making an incision right down the center of someone's lower back, peeling off all the muscle tissue off of the bone, removing the bone. It involved blood loss, transfusion, a 7-day hospitalization, chronic pain, months and months of rehabilitation, compromise of financial support not only to the individuals, their family, the community, but also the loss of love and caring and camaraderie of their family and their friends. That particular type of surgery where you would structurally stabilize and permanently connect spinal bones together in the low back is still ongoing. And it's still something that is being done more than it needs to be done. And in 1989, a young man in Louisville, Kentucky was involved in a motor vehicle accident. And as a result of injuries sustained in that motor vehicle accident, for the next 15 years, he suffered every single day, and persistent and chronic pain that radiated from his back into his backside and down his leg, diminished and compromised his ability to perform activities that you and I take for granted. Playing with his children, getting down and lifting them up, playing ball, being close with those he loved, being denied access to the day-to-day things that you and I do without thinking about it. Based on a commitment, a desire for excellence, Medtronic invested their time and their resources to help develop a product and a scheme of instrumentation that allows patients to come in as an outpatient, eliminating the need for transfusion, eliminating the need for protracted and long-term medications for pain and rehabilitation. And we've made so much progress that patients are now having these treatments and fusions performed on an outpatient basis. And they return back to work in half the time and return to their normal level of activity, not a compromised level of activity, but their normal pre-injury activity, where no other procedure in the world can mimic and reproduce that. I salute Medtronic and I salute their spinal division for their commitment to excellence, their passion for innovation, and their uncompromising determination to do whatever it takes to improve the lifestyle and improve the health and health benefit to all the people that they have access to and can serve. I applaud you, I salute you, and just keep doing it because we appreciate what you do. Our patients appreciate what you do. And we're there and thanking you each and every day you sit in your office and do whatever it is you do, because you don't necessarily get the feedback I get when a patient comes back and they get rolled in a wheelchair and they walk in and I don't even recognize who they are because I don't remember them being so happy and walking and smiling and being so content with their new regained lifestyle. So with that in mind, let me introduce my patient also from Louisville, Kentucky, David Johnson, who will tell you his story, which is amazing even as many times as I've heard it.
First off, I'd like to thank each and every one of you for allowing me to come today to tell my story. And a very special thanks to my surgeon, Dr. Rubin, who performed the surgery and asked me to represent his practice. You've all given me the greatest gift possible this year for Christmas, and that's a pain-free Christmas. Something I haven't seen since 1989 when I was involved in a car wreck. Things that we all take for granted, such as sitting down, watching a movie with your family, or simply going for a drive, were painful. Activities that I once loved and participated in, such as skiing, snow and water skiing, soon went by the wayside as the pain became too great. Probably the worst thing, though, was the inability to sit on the floor and play with my 2 young children. I have a little boy by the name of Sam, who's now 6, and a daughter named Caroline, who is 4. Oftentimes, after spending a brief amount of time on the floor with the 2, it would take me literally crawling to the nearest piece of furniture, dragging myself up, and then enduring a long amount of pain once I'm back up on my feet. I manage a large funeral home in Louisville, so recovery was a main important issue that I had to deal with. At the end of last year, I started looking and saying, I have to do something. I can no longer go on living the way I'm living. I interviewed several doctors, did a lot of research on the internet to look for minimally invasive spinal surgeries. Unfortunately, when I would go visit the doctor, I was being told over and over again, you're looking at the earliest would be 3 months before you would return back to the funeral home. The latest would be about 6 months. With the volume we do at our funeral home, that was not an option to put my staff in that bind, nor, as my wife Laura would tell you, I can't avoid being away from the funeral home for 2 days, yet alone 6 months. So it was very important that I got back to the funeral home in a very timely fashion. It was about a month and a half after my last visit to Louisville spine doctors, where I was told was looking at a 7-month recovery following a fusion, that my wife called me one day very excited. She said, you need to call this phone number right away. On our noon news, she'd seen Dr. Rubin talking about a new procedure he was pioneering in Louisville. I called, made an appointment for about 6 weeks later, went home that evening. She had taped the program. I watched it, became excited, but didn't want to become too excited because I didn't know if this would really work for me. I had the initial visit with Dr. Rubin's assistant due to the fact that he was busy, set up some pre-surgery testing to say that this was a procedure for me, and went into the surgery thinking that, hey, if I get a 50% improvement of what my life is today, that will be better than what I'm living now. So my goal was just simply 50% better than what I was doing. Never forget the morning we went into Jewish Hospital. Dr. Rubin grabbed my foot and he said, are you ready to be done with this pain? He also gave my wife some very specific instructions. He said he'll go home tomorrow, he'll get his own newspaper, he'll get his own cup of coffee, he'll dress himself, and he'll go upstairs to his bed. I thought, sure, that's really going to happen. Well, after what Dr. Rubin had told my wife at that point, he said, Laura, normally I'm out an hour and a half to 2 hours, and I'll talk to you. We'll go over it, and he'll go home that evening. My surgery lasted around 5.5 hours. She was becoming very nervous, had not heard anything, and Dr. Rubin came out. And as Dr. Rubin always in his joking way said, she said, I thought you talked to me in around 2 hours. He goes, got a new record, but he's doing fine, and he'll go home soon. Well, I went home the very next morning. They came in, allowed me to walk. They said, can you walk the halls? I said, sure. I said, I'll be happy to do the steps for you. So we went up and down the steps of the hospital, and I went home. And went home that day, resumed my activities. I did get my own coffee. I actually walked up and down the driveway several times that day, and by day 2 was walking around the complete neighborhood. Well, I decided that while this time I was down, it was a good time to get a hernia repaired that I needed to have done also. So I had cleared with Dr. Rubin prior to the surgery. I said, would it be all right? He said, I've had a hernia repair. He said, that's kind of rough, but if you want to take it on, take it on. So I called the hospital. It was a different hospital they called and were asking some questions prior to admitting me. And I said, I do need to tell you, I had a spinal fusion done 3 days ago. And they said, excuse us? And I said, I had a spinal fusion 3 days ago. And they said, and you're willing to come in and have the hernia repaired? I said, sure, I've cleared it with my doctor. We just need to be careful in moving me around. So they said, okay. That morning, it was about 6 days after the initial spinal fusion, I walked into the local hospital, walked back in to prepare myself for surgery, and was getting undressed, and this nurse came in. She said, is it true you had a spinal fusion? I said, yes. She said, we've never seen anyone walk in after having a spinal fusion, let alone get up on that bed and undress themselves. So, needless to say, several doctors came in and out throughout that time prior to surgery to see if I truly had had a spinal fusion. I actually had to roll over and show the minimum scars of where the spinal fusion was done. The remarkable thing is, 2 weeks following the spinal fusion, I woke up on a Monday morning, and it would have been sooner, but he wouldn't let me drive for 2 weeks. We have to remember that. So 2 weeks following the surgery, I got in my car, drove to the funeral home, and spent the first 12-hour day back at work absolutely pain-free. I have been absolutely pain-free from the moment I woke up from the surgery and have not suffered any pain since then. It's a life that you can't imagine. With those years of dealing with the pain, it's not only the physical pain, but it begins to take a very heavy emotional toll on any of you that have dealt with pain. The relief of the medication's gone. Not only can I play with the kids on the floor, my 6-year-old will jump on my back, wrestle me to the ground, and it's great not to have to worry about being hurt. Dr. Rubin says you can't mess this up. You can do whatever you want, so hopefully next year I'll be back snow skiing and moving forward. So to say that what you do is important, it's very important. As you can see by the 6 of us here today, what you do every day changes lives. It changes families. It makes our life a whole lot better. So as small as the job that you may do here at this company is one of the major jobs to people like us who have endured the procedures, received your products, and are here to say, hey, you've made my life better. In our family, 2 members of our family have been touched by Medtronics. I have a father-in-law that has been able to see his grandkids when it was not diagnosed that he would, due to the fact that he received a Medtronic defibrillator and pacemaker around 6 years ago when he was in congestive heart failure. He's now doing well and is able to see the grandkids and sees them almost daily. So I'd like to thank each and every one of you for what you do, the talent of my surgeon, Dr. Rubin, Medtronics for the wonderful 2 days we've had here. Please keep up the good work. May you all have a wonderful holiday. And always remember, everything you do is important to us. Thank you.
I had the opportunity last night at dinner to sit next to Dr. Rubin and David, and I'd like to mention one part of our conversation. We're going to focus tremendously today on all the wonderful products that Medtronic provides to literally millions of patients around the world. But I was very interested because Dr. Rubin spent time talking about the other very important part of the equation, and that's it's not just the products, it's the people that represent Medtronic. And not only the ones that are in the operating suite supporting physicians, but the ones supporting all of those people. So Dr. Rubin really brought that point home and also mentioned that he thought that the Medtronic employees that he dealt with on a daily basis had ethical standards that were well above anything that he saw anywhere else in the industry. So not only for our products, I want to thank all the employees that support the physicians on a daily basis.